30 million more Americans will now have high blood pressure, according to new medical guidelines that were just released today that lower the threshold. This means nearly half of U.S. adults have hypertension.
Health reporter Stephanie Stahl is here to explain new numbers.
That's right. Lots of people impacted by this. For the first time in more than a decade, the American Heart Association is changing its guidelines for what's considered high blood pressure. It covers a lot more people, which means millions more face an increased risk for heart disease.
Let's check the blood pressure.
Charles Cronenwealth has been working to lower his blood pressure for the last 10 years. Now, with the new guidelines, tens of millions of additional Americans will soon be learning they have hypertension too. The American Heart Association and the American College of Cardiology are now defining a top reading of 130 or more or a bottom reading of 80 or more as high blood pressure. The old definition of high was 140 over 90.
Most of them just need to know they're at high risk, but they can manage that problem on their own.
This change is expected to have the biggest impact on men and women who are under the age of 45.
That would mean that they would have to exercise more, have a better diet, a diet that's low in sodium, restrict alcohol, and lower stress.
Under the new guidelines, 120 or less is still normal blood pressure, but up to 129 is considered elevated. And at 130, there will now be different stages of high blood pressure, which increases the risk of heart attacks and strokes.
Preventing getting hypertension is much better than treating hypertension. It's good to treat it when it's there, but it is way better to prevent it.
Charles says he checks his blood pressure every day. Plus,
try to eat a heart-healthy diet and exercise.
Doctors say now more Americans will need to follow in his footsteps. Now, the new guidelines also emphasize making sure blood pressure readings are accurate. They should be based on 2 or 3 readings taken at least in 2 different time frames. And they also want people to make sure they understand the proper techniques for checking their blood pressure at home. They also say, of course, when diet and exercise don't work, there are effective medications that can be used for this.
Sure.
So the magic number now, 130 over 80 or lower.
Or lower.
Got it.
Lower
Got
is
it.
better.
All right, it is.
All right, Steph, thanks.